Hello, everybody. My name is Giora Sharf. I'm from Israel. I run two local patient organizations, the Israeli CML Patient Organization and the Flute of Light, the home of blood cancer patients in Israel. And I'm going to talk to you how we overcame the COVID-19 pandemic challenges that happened this year. So the pandemic, which started in around March, brought many and new challenges, both and mainly for patients in Israel, but also for our patient organizations. The patients, who most of them suffer from impaired immune system, they felt scared and afraid to leave home and to go to doctors for appointment, to go to hospital to get treatment. They were lacking information what they can do and what is things that they cannot do. Because of the lockdown, the patients without car could not get to hospitals from their home and back. The public transportation was closed for more than a month, and patients actually who did not have private transportation could not get to the hospitals and the doctor's appointments. And the patients who were locked at home for quite a long period of time started suffering from anxiety and from psychological issues. And if you remember the first day of the pandemic, there was a huge shortage of all protective measures like masks and glasses, both for patients and also for staff at hospitals. So what did we as patient organization do to overcome these challenges? So naturally, we had to switch all our activities to virtual activities. The last face-to-face meeting we had was on March 5th. And since then, of course, we could not have any more meetings. Everything was switched to virtual. So we started organizing weekly webinars on various and urgent topics. And we called it your hourly patient organization meeting. And actually, it was very popular, as I show you in a few minutes. We publish national and also international recommendations from doctors for each disease and patients, what they can do and what they can do. We also strengthened our psychological support programs we have. For example, we have a mentoring system where we connect a patient, experienced patient, to a newly diagnosed patient. So we strengthened that program. And also we are using a mentor, a health mentor, is a qualified person who was trained to escort patients. And we strengthened that services also. And we had to create a transportation program to help all blood cancer patients in Israel to overcome the challenge of getting to hospitals and back. And I'll talk about it in a minute. And I think the first thing we did, we are able to purchase thousands of face masks and protective glasses and supply to patients and staff in the hematology department in the various hospitals around the country. So let's look at the transportation project, which was one of the big projects we took upon ourselves. I think one of the most important things, it was done in collaboration. First of all, with the National Hematology Association of Israel, who we did it together. And then also we have about 3 more blood cancer patient organizations, for example, myeloma or MDS, and we actually incorporated them into this project. We have given the same services to the patients of them, their patient organization, like we did to the one who belonged to ours. We had to set up the criteria which participant can join the service and which one not. We could not distinguish which patient really needs it and who. So to find the first screening of criteria, we contacted the social workers in all the hematology department. And since they know the patients and their needs, they were actually setting the criteria and screening, and they were the ones sending us a request to add patients to the program. We had to find the best cost-effective solution. It's a very expensive program. You know, some of the patients live in the north or south. They are being treated in the centers of excellence in the center of the country. So a taxi drive, and we are sending taxis to each one of them separately, can cost 250, 300 euros sometimes for each way. So it can be a very expensive program, and we had to find a cost-effective solution. So we negotiated a really good deal with a company which has country spread services of taxis, similar to Uber, but working in a different way. And it's all done over the internet, over a platform that we can put all the reservation in, and it's not too complicated. We had to fundraise for this program, and we did it very quickly with the support of the National Hematology Association, who requested all pharma companies in Israel who work with them to support this program. We have to locate an operator of the program, because actually it requires like a taxi dispatcher sitting in front of the computer most of the day and being able to connect the taxis and the patient both at home and the hospital, make sure no one is left outside. And we had to publish a program in all our hospitals to make sure that the patient are aware about this service. So the results of the program from April till today, you can see that the feedback and the responses from all the stakeholders, doctors, social workers, nurses, and of course the patient, was very positive. And they said this is one of the most effective programs that help patients very much. From April until today, we did 1,060 transfers for more than 250 patients all over the regions of the country. We raised about 75,000 euros from 8 companies, and the cost so far is about 47,000 euros. So we still have money left for the program to continue, and the project will continue as long as needed. And actually, we already started raising more funding for the phase 3 of the project. So let's look also how we implemented the transition to new virtual reality. I think one of the things that we did is contract a virtual conference company, similar to the one which is organizing this meeting, to handle the logistic and all the technical aspects of holding webinars, either on Zoom or on the Facebook. Like I said, we set up a weekly webinar, and the topics range from dealing with the corona at the beginning, so patients to calm them and explain to them what they can do. A psychological support program that we did also on the webinars. How do patients change the treatment and monitoring when they need, when they can skip appointments at hospital? How do they switch to virtual doctor appointments without the need to come to hospital? Who can do it, who cannot do it? And because patients were sitting a long time at home, we started also doing webinars on topics that are important for them, like example, nutrition during the pandemic, some home exercises and Tai Chi classes given by experts to patients at home. Patient rights. Many patients were laid off work and they didn't know what are their rights. So we had a webinar about this topic, and also alternative and complementary treatment during the pandemic. Because of the tension that patients were starting to suffer, we had to think outside of the box. What are the topics which can help patients ease and relax from the tension? So actually, we launched 2 types of therapy workshops, one of them of writing and the other one of phototherapy. And these were classes that we did on Zoom with experts, one for writing, one for photo. And this gave the patients the opportunity to express the tension and all the issues they had through the writing and phototherapy. And it was very well accepted, and we had much more demand than places open. And we already continue to do it every 2 weeks. And we, at the same time, continue to do all the disease-specific presentation and empowerment of the patient with experts. And we held the first BMT patient virtual conference, also the acute leukemia patient meeting just recently. So look at the results of this program. So we had huge number of viewers ranging from 350 to 4,000 in different webinars in Facebook Lives. All the talks and presentation were recorded and can be rewatched over our YouTube and website. And many new contacts and patients contacted our organization and joined us. There was an increase of about 15% in both organizations. And social media activities and outreach increased throughout the whole period. So if you ask me today what recommendation I give to patient organizations who want to implement similar, first of all, don't try to do it by yourself. It takes a lot of time and a lot of efforts. Contract expert companies, one like the virtual meeting company, another one, for example, we contracted was a digital company that did all the support we needed for all the digital aspects. For example, setting up the digital strategy of our organization, doing all the writing of the post and the newsletter, graphic design, publication, managing all the social media channels we have, like Google Grants, YouTube, Facebook, etc. Get yourself familiar with the virtual platforms like Zoom, Facebook Live, GoToWebinar. Know which one to use for which audience. Adjust the resources you have to the activities, especially the human resources, because most of us are lacking this most of the time. Try to keep the virtual meetings as interactive as possible with plenty of opportunity to ask questions and make comments. And use the pandemic time to cover topics you usually do not do. Like I gave an example about the writing and phototherapy classes, the home exercises. This is something that is very helpful for the patient. And strengthen the relation. This is an opportunity to do that with all the stakeholders, especially the healthcare providers. So here you can see some of the posts that we have published. The top right, you can see the one for the phototherapy. Below that, the one on the writing therapy. And here already on our website, you can see examples of pictures that patients who participated in the phototherapy workshop have already published on our website. So I thank you very much for your attention.